we're also preparing guidance for the general public and impacted industries. We'll have this very specific timeline and requirements. But when in doubt, just stay home. I mean, that's the safest thing. We're safer at home, and especially for our most vulnerable populations, seniors, and those with pre-existing conditions. May looks just like April. They need to stay at home, except when absolutely necessary. Um, our success as a state in keeping our loved ones and ourselves and our families alive and safe is really about personal responsibility and the choices that Coloradans make around doing what's safe. And we can put all the precautions in place in the world, and we're going to work hard to enforce them where we can. But that individual responsibility element is so key. And now as we get to the stage where there's real business level enforcement, I'm also signing an executive order that creates an advisory board on how we can succeed at the new safer at home phase for the long haul, right? Remember, this is not just a thing for the next week or two. It's for May, and it'll likely have some changes, but it'll likely have very close similarity to what June looks like. We certainly hope that we're making progress and there's additional activities that people can safely engage in. This board will advise me and CDPHE on the policies that we need to maximize social distancing at the local level and how to enforce them. So we want to have that discussion and include the voice of local government, law enforcement. So we'll have representatives from counties, from municipalities, from local law enforcement, local public health, Economic Recovery Council, which is the private sector and business community. And then internally, it will have Department of Public Safety Director Stan Hilke, Public Health Director Jill Ryan, DORA Director Patty Salzar, and my Chief of Staff Lisa Kaufman. So that's going to be very important as we talk about how this really looks on the ground, safer at home, what it looks like for the future to make sure that it works for individuals, for public health, for businesses, and for our own fulfillment as Coloradans to be able to do this social distancing in a sustainable way. I want to thank the Colorado National Guard for their amazing work helping with testing. They've tested 3 senior living facilities in Colorado Springs, Broomfield, and Thornton. 900 tests, 20 were positive. And by identifying those 20 positive cases and removing them from the workforce, that act alone, likely saved dozens of lives of seniors who are most vulnerable. We're going to continue to work with those senior living facilities, additional senior living facilities, including in partnership with CSU, to do more to screen asymptomatic workers to help keep our seniors safe and prevent additional site-based outbreaks. I'm proud that 33,000 face coverings were delivered by the Colorado Mass Project to folks who serve the homeless and most vulnerable. Thank you, Colorado Mass Project. I also want to encourage Coloradans to, of course, stay away from the mountains this weekend, recreate within 10 miles of your home. I know the weather's nice, but the coronavirus doesn't care about the weather. They care about physical proximity, and we need to make sure that we stay safe. If you are going to recreate outdoors, do so in areas that are not, within 10 miles of your home, at least 10 feet away from others, at least 6. Wear your masks if you're in an area with others. Look, Colorado is beautiful. That's why we live here. But our mountains and our rivers and our forests will be here long after coronavirus outbreak, long after any of us. So give it a break, and we look forward to being able to have more of those recreation opportunities in the future. I want to thank DORA, Department of Regulatory Affairs. They've issued 264 emergency healthcare licenses to put more workers on the front lines. These are under our executive orders, freeing up people. They might be from other states. They might have had applications here, but thanks to DORA's work, 264 more emergency health workers are able to join the front line. And if you're sick with something other than COVID, just a reminder, if you need to go to the ER, go to the ER. If you're having chest pains, dizziness, if the symptoms that you have would have led you to go to the ER in January before any of this COVID started here, you might, we still have appendicitis, we still have cancer, we still have heart disease. Don't let the threat of coronavirus deter you from getting the medical treatment that you need. It could save your life. One point of clarification, the public health orders required facilities serving seniors to take extra precautions to protect their residents, which means the orders, some of the very first ones we did, limiting visitation, symptom screenings, isolation plans, apply also to assisted living residences. There's been some misunderstandings in the terminology. Nursing homes, senior living facilities, congregate care facilities for the elderly. So with that, we would love to open it up. Monday, we will have detailed guidance around to many areas that we want to do it as safe a way as possible. And Monday, curbside delivery for retailers. And some of the elective surgeries are also coming back. There's letters and guidelines on that. Any hospital who does that has to have enough PPE and be able to meet those needs and make sure they're prioritizing it for COVID. But if they meet that, of course, we know that many of those so-called elective surgeries aren't truly elective. I mean, I know that many people are in pain, conditions are getting more difficult, and while you might have been able to put it off a month, we know you can't put off what is necessary and important to you for very long. So those are being scheduled at ambulatory care centers and hospitals across our state. Let's go ahead and open it for questions.
Hello, Governor. This is Vinny Del Giudice at Bloomberg News in Denver. This is a question about the federal air bridge program. It transports PPE, masks, what have you, to the front lines. But medical supply firms, as we understand it, almost always maintain ownership of the supplies. They take bids after the supplies arrive. Has Colorado used AirBridge? What are your thoughts about the program? And also today, did you speak with Vice President Pence on the conference call to the states? Thank you, sir.
I did, and AirBridge was certainly one of the things we discussed. We discussed it last week as well. I was on a conference call with the Vice President this morning to confirm that. I've spoken to him individually and on conference calls several times each week. We are very supportive of AirBridge and other federal programs that can provide PPE to our first line responders. I'm not sure I understood your question about ownership. We're not focused on who owns them. We just want them deployed and used in the field. But it doesn't meet our full needs. We have that is augmented by state work around acquiring PPE, and we've had a number of successful acquisitions from China, from other countries domestically. Private sector acquisition, meaning our hospitals, especially the larger chains, are acquiring PPE through their supply channels. And yes, the federal government is helping as well to help meet the needs, both in the critical care facilities, the hospitals, as well as some of the facilities that need help preventing outbreaks like senior and assisted living homes. Next. Next question.
Give me 1 second, Governor.
Hi, this is Marianne Goodland with Colorado Politics.
Hi, Marianne.
Hi. What is your intention with senior facilities, nursing homes, and the like? Is it your plan to have all of them tested or just the one with outbreaks? How far down the list do you intend to go?
Yeah, it's one of the priority uses of testing to be able to test asymptomatic workers at senior care facilities. We already are doing the symptom screening of those workers, but we also know that about half of people who are contagious with COVID-19 are not showing symptoms themselves. And the model for what we've done at the testing several hundred, finding a number of positives, that's what we are expanding across the state to be able to test more and more of the workforce that are asymptomatic. So of course, symptomatic people are tested too. That's a given, Marianne. But the focus here in the additional capacity is around testing people that have no symptoms but are going into work at senior care facilities. And once isn't enough, right? So it has to rotate back to have another test a week later. Really, it's an ongoing part of our work that is stepping up during May to help keep our most vulnerable populations safer.
Thank you.
Governor Charles Ashby from the Grand Junction Sentinel. How are you, sir?
Good, Charles. Thank you.
Hey, so I know you talked about enforcement, and I know you're still working out the details to how that would, what that would look like. But I mean, I'm trying to get a sense of how you think that would look. I mean, imagine you don't want law enforcement or state patrol or National Guard storming a business or a county that's not complying. So how do you imagine that would be done? I mean,
yeah. Business level enforcement is a lot easier than individual level enforcement, and part of the rationale behind moving from stay at home, which is theoretically enforcement of individuals that are out that shouldn't be out, but in practice is no real enforcement, to safer at home, is that there are real enforcement mechanisms around businesses. That means the ability through county health departments to close businesses that are violating health orders and operating in unsafe ways. It means the ability of local law enforcement to be able to have that visibility. And that's why the buy-in from local jurisdictions is so important, because most of the law enforcement resources and civil enforcement resources are localized. And so we look forward to continuing to work with the mayors, the police chiefs, the county health departments, and many others to ensure that there is broad compliance with the steps that are needed at businesses to make sure that their employees are reasonably safe and that customers that enter those businesses are reasonably safe.
Sam, you are on the line.
Oh, yes. Hi. This is Sam Tabachnik, Denver Post. I wanted to ask a kind of a follow-up to that question. So, we were writing about Weld County this morning, and Weld County, the commissioners have said basically they are allowing businesses to just open where they say they can open whenever they want. They don't have to. What can the state do in terms of county-wide directives? Because some counties are extending their stay-at-homes. Some are saying basically we want freedom and we don't want to abide. So what can you do with counties such as Weld?
So there's a process for relieving certain restrictions and getting variances. Eagle counties was the first to be granted in the state. Mesa County is expected to be granted soon, today or tomorrow, or the next day, very soon. Jill Ryan indicated in her remarks publicly at Eagle that she expected that Mesa County would be granted very soon. As far as I know, we've not received a request from Weld County. They do not have any kind of unilateral ability to jeopardize the health of residents of Weld County. And as governor, I'll take whatever steps necessary to protect the health of the residents of Weld County, one of the hot spots with one of the highest per capita rates of COVID-19 in the state. They issued guidance on their website. Their guidance was fine. It's not as thorough as our guidance, but if they in any way think that businesses that aren't meeting the statewide guidance are somehow able to operate in a free-for-all, if they're planning on saying restaurants can open and clubs can open and businesses don't have to have social distancing, that would be a great danger to the people of Weld County. And they have not even requested any type of variance around what they want to do that's different than the state. We welcome those, by the way, and they're multi-stakeholder. This came from the commissioners, but from Mesa County and Eagle County, commissioners, county health departments, the local hospitals, when they're on the same page and they're able to end the stay-at-home earlier, as Eagle and Mesa are seeking to do, we applaud them. Weld County has not applied for that. They've instead, while the health guidance on their website is reasonable, but not as thorough as the state guidance, if they're intending to use that in a way to supersede the more thorough state guidance, then it's very clear that they are not allowed to because it jeopardizes the people of Weld County. Think of this, we're all accustomed to restaurants. They get A's, they get B's, they're inspected, right? A county is not able to say, we're not inspecting our restaurants, and therefore they're potentially a danger for hepatitis or other diseases. We have basic public health standards at the state level, a process for flexibility for local jurisdictions that Mesa and Eagle are participating in. Weld has not participated in that. And while their guidance is reasonable, although not thorough enough, it's not clear at this point what they're going to do with it. And they are very clearly not allowed to forego the kind of social distancing that needs to occur in businesses for them to be able to successfully operate and protect the public health.
Hi, Governor. This is Anusha with 9 News. We have had a couple of people reaching out to us worried about going back to work out of safety and health concerns. Talking to the Attorney General's office earlier today, they said people's options will depend a lot on the executive order. So we were curious if the state is offering any kind of guidance or advice for people who don't necessarily want to go back to work yet, and if that will be addressed in the executive order.
Yes, specifically those who are members of our most vulnerable population, people that are 65 and up and work, or people with pre-existing conditions like moderate to severe asthma or hypertension. You should remain at home this month, whenever possible, and only leave for essential activities. When workplaces return to 50%, and to be clear, that's May 4th, not April 27th, right? April 27th, curbside delivery. But what happens May 4th is workplaces can return to up to 50% of the density. The 50% who are telecommuting or not going in, that should be prioritized for those who have pre-existing condition and older Coloradans that are still in the workforce. So that's very important in the implementation of that. That'll be part of the guidance on Monday. It's also important that Coloradans put this in perspective. I mean, if you're able not to work, if you're able to have unemployment insurance or get by off your savings or the $1,200 you got, that's a wonderful thing. But just recognize that all Coloradans can't. Some have to work to live, and there needs to be a way to do that. But if you're able not to work, of course, the danger of the virus will continue. And the danger of the virus will likely continue through summer, even fall, right? So as you're thinking about what risks you want to take on yourself, you have to balance that with, can I afford not to make a living for 6 months? And some people can. Maybe you're 68 and you get some Social Security and have a small pension, but you work because you want to have additional money, but maybe you can forego it for 6 months. If you can, that's a very, very, very good decision, right? A very good decision to keep yourself safe. But there are others that have to put food on the table for the family and make their rent and need to work. And we want to have more opportunities to do that in as safe a way as possible. Next question.
Stephen Tubbs, you're on the line.
Stephen? Stephen? Maybe we'll come back to Stephen. He might be having technical difficulties. We'll have to go back to him. Oh, hold on.
Allison Levine, you're on the line.
Allison, go ahead.
Hi. Yeah, I'm wondering if you can clarify what your language is about reasonable guidelines on the Weld County aspect. And also, can you go into a little bit further what you can do if you feel that their restrictions and limitations as they attempt to reopen are not in line with.
So I thought their guidelines were reasonable, but not as thorough as our state guide. Like they put little posters that people can print out and post in stores, and they were fine. They said, you need to wash your hands, you need to stay 6 feet from others, and stores should do that. And those posters are, whoever did them in the Wolf County Graphics Department did a fine job. It depends what they say they're trying to do with these guidelines. If they're trying to say, without requesting any state variance like Mesa County did and like Eagle County did, we instead are going to open up every business as long as they do these basic things, that would be extremely dangerous. My pledge to keep the people of Colorado as safe as possible, the role of the state government in protecting the public health would prevent Weld County from doing that. And so they cannot, if that's the intent to use it that way, they cannot use it that way. If they have a thoughtful approach to request a variance, if they want to open some kind of business sooner, like Mesa and Eagle County are, that's completely appropriate. They need to put that on paper about what those, in a thorough way, what those safety requirements are, how they're doing it, make sure that their hospital and their health department are on the same page. And we will act on that within a few days. We acted on Eagle within a few days. We're acting on Mesa within a few days. We would, of course, encourage a thoughtful approach from Weld or any other county. But Weld has had a very high number of cases. They are one of the highest per capita number of cases in the state. It's a hot spot. This is not the time to further ease off of restrictions in Weld County, even beyond the way that the state is trying to allow for more safe practices. So we want to work with the commissioners. We don't want to participate in political games. We simply want to have a thoughtful dialogue with them. If there's something they want to do, they can formally request it. Their guidelines are basic, not thorough, but they are fine and sound, and their modeling is fine. But if they're trying to use that to supersede the guidance that is needed to keep people safe, then that would not be a legal way for them to achieve that goal.
Governor Vicente Arenas of Fox 31, you mentioned that you do not want people to go to the mountains, and you're asking them to stay within 10 miles from their home. We've seen in previous weekends that the sides of the roads up in the high country have been packed with cars. What sort of enforcement measure, or would you take an enforcement measure to make people pay for going out into areas where they are not supposed to?
It's really important that people recreate in areas near their home for two reasons. One is so that people aren't congregating in areas that might be beautiful, but are become dangerous because too many people choose those areas. The second reason is we don't want more regional spread of the virus, right? So areas that are just turning the corner and getting control of infections do not need a whole new round of infections from people from Colorado Springs or Denver who are going to those areas. So there's two important reasons. And if you live near municipal parks, if you live within 10 miles of a state park, those are open, but they are for people who live near them, not for people from other communities. We absolutely want to work with local law enforcement around stepping up enforcement. And it's really important, and especially with a beautiful weekend coming up, that people are recreating near their home so as not to catch the virus from folks in other places or to spread the virus to people in other places.
Hi, Governor Stephen Tubbs. Can you hear me?
Yes, you're back, Stefan.
Okay, thanks, Governor. I'm just wondering, over the last few weeks that we've all been listening to your updates, you've really been talking a lot to Coloradans. And I want to go to how I know you may be understanding how frustrating it is for Coloradans right now, where they hear Denver Mayor Michael Hancock this morning. They see what Jefferson County is doing. Tri-County may be doing one thing, Weld County may be doing another, and then your message from the state. What do you say to people that they're going, I really don't know what I'm under right now? And is there a danger of maybe people then going off and maybe going to do their own thing, if you know what I mean?
So I try to speak to a statewide audience. No matter where you live in Colorado, you should stay at home unless you need to go out for something you need to buy or for the necessary physical exercise. That's the way that we're going to beat this is those individual decisions people make not to socialize, to stay at home when they can, because people are safer at home. I recognize that there are different situations on the ground across the state, different situations in Mesa and Eagle County, which is why we're working with them to give them that flexibility, a different situation in Denver and Jeffco. No matter where you live in our state, you should wear a mask whenever you leave the house and are in public places. That means when you're at the local park, it means when you're at the grocery store. It's really important that if we're going to be effective in this safer at home phase, that mask wearing rates increase over what they have been for the general public. It's extremely important. And it also recognizes statewide the reality that people need to earn a living. A certain percentage of the workforce has been working through this, the critical workforce. There'll be a few more folks now that are able to go to work and earn a living. I know folks need that. Folks appreciate that. It's not yet everybody, but it's certainly a lot more folks. And we need to do it in as safe a way as possible. Now, what Denver has done in a very thoughtful way is they said, look, we need a little more time to operationalize to figure out how we're going to enforce these health requirements that we're putting it out on very short notice, right? We'll be talking about a Monday, but they're really going live right after that. And it's completely understandable that somebody's saying, look, May 1st, we're not ready to have the inspections of the retail to make sure they're safer and all of these things. We need another week. So it's very thoughtful to say as a jurisdiction, look, we have a lot of COVID-19 here. We want to operationalize these protections. We want to make sure they're being enforced. We're going to go to May 8th. And that's what Denver is doing. So there's big differences across our state. I try to stick to the statewide message. Wear a mask whenever you go out. You're safer at home. Whenever the more you can stay at home and avoid socializing, the better. And let's continue to work to protect our seniors and most vulnerable. That means we are, Stefan. That also means I hope that you are, not you personally, although I do hope you are personally, but your listeners, your viewers. It means if you have an elderly neighbor who's 76, offered to bring groceries to their home and leave them on their doorstep. Just those small steps so that they don't have to go out can make an enormous difference in saving lives.
Governor, it's David Clue, Denver 7. Good afternoon, and thanks for this opportunity once again. There is a lot of talk nationally about a second wave of the coronavirus coming this fall about the same time, as inconvenient as that is, as the flu season. Is there any energy that the government here in Colorado is spending on looking that far ahead at what we may need to be doing through the summer and into the fall related to that potential second wave?
So a lot of our models show that there will continue to be a great risk of contracting COVID-19 all through summer. While there's some data that shows that high temperatures kill it on surfaces, that doesn't help the overall social contagious nature of the disease. So it will likely continue. We, of course, worry about the overlay between the regular flu season and COVID-19. We're going to encourage people to get their flu shots, of course, at the appropriate time when they're available, usually in August, to help reduce the severity of the flu season in Colorado. But COVID-19 is likely to be with us, not just this summer. It's likely to be with humanity in a way that the flu is forever. And we hope that there's a vaccine soon, but it could very well be like the flu vaccine, that it controls it to a certain extent, but not 100%. It's very unlikely COVID-19 will be extinct. It's likely it will coexist with humanity as the flu does. And we hope that there are vaccinations that are effective to reduce the spread and reduce outbreaks this fall or winter, or cures that work clinically. But in the meantime, we need to manage this throughout summer and the fall and the winter. And we don't yet have visibility into whether there's a second peak in fall or not, but we're trying to get our way through summer with case levels that don't exceed our hospital capacity. Brandon Thompson. Oh, Brandon Thompson went away. Who else do we have?
Brandon, will come back to you.
Okay.
Sadie, you're on the line.
Sadie, go ahead.
Thank you. So you said that local buy-in will be very important for enforcing this new phase, but it's apparent that Weld County has not fully bought into the state's order. Can you elaborate on what the state is able to do to enforce violations at a county level, and what you might do on Monday if Weld County did follow through and open businesses that were not permitted to start opening?
Well, if any county is not treating this like the emergency that it is, then they risk losing emergency funds. And I know that's very tangible for residents of any county. The local buy-in is critical, and that's why we are excited to work with Mesa County, with Eagle County, with any others that have better ways that they can open up more or quicker. We're happy to work with them and get those approved. Weld County has not requested that. They've simply said, now again, their guidance is basic, needs to be more thorough, but largely consistent with our guidance. But if they're trying to use that guidance in a way, which is what one commissioner said, they've never told us this is their intent, but a commissioner did say, if anybody meets our Weld County guidance, they can be open no matter what they do or what their business is. If that's what they are doing, then that is unsafe for the residents of Weld County, which has one of the highest per capita rates of COVID-19 in the state. And we will absolutely use every mechanism we have, including they will forego their own eligibility for emergency funds. Those businesses could lose their license to operate under the state if they're state licensed businesses. And it's very important that if Weld County wants to do something differently, we encourage that. You should apply for that, and we'll work with you to do that. But if you unilaterally are saying, as at least one commissioner said, that we're simply not going to follow any of the health and safety guidance of the state and any business can open that meets these basic criteria, then that is endangering the lives of the residents of Weld County. And as governor, I'm going to act to prevent that and protect people in Weld County.
Hi, Governor.
Brandon. We lost Brandon again. He might be having technical difficulties. Who's next?
Hey, Governor, it's Jesse Paul at the Colorado Sun. This morning, Denver Mayor Michael Hancock said that, businesses can be fixed and put back in shape and the economy can be repaired. But, quote, what we cannot do is replace lives that have been lost. It seems that with the safer at home order, you're suggesting that we can kind of manage those two. And then the other question I wanted to ask was, who do you see as going to these retail businesses that are going to be reopened, since you're telling folks that they should stay home anyways? I mean, do you really think that this will have any kind of economic impact, this kind of slight shift that we're making?
Well, people are safer at home and they've been shopping, of course, when they need you. They've been going to grocery stores and pharmacies. There are other goods that they might feel that they need to buy, and I expect that there will be. I don't expect that any businesses will necessarily be at the level of business that they were before this crisis. But for many small businesses, being able to operate even in a limited way, very well could mean the difference between existence and non-existence of going out of business or being able to continue to employ people for months and years ahead. So consumer behavior should remain cautious. It will remain cautious. It's not a time for anxiety or fear. it's a time for caution. And I know that folks are doing that. When you look at every model that has been created, Jesse, no model shows the disease being stamped out in Colorado or America. There are very few places in the world that are able to do that. Taiwan, New Zealand, perhaps will pull that off. They're islands. They acted early. They could very well eliminate the virus in their borders. It's not possible in a country where there's, I think, over about 1 million people that have contracted it already, with people who move back and forth between the states every day. So it's going to be with us. And we need to do what we can to save lives and make sure that everybody who gets it has a fighting chance to survive, meaning they have the hospital bed and the treatment that they need. We're generally successful. I mean, there will still be fatalities, but without the ability to go on oxygen or the final intervention, which would be a ventilator, the fatality rate would be much, much, much higher. So we don't want to allow it ever to exceed our capacity. It's why we built additional capacity here in Colorado, and why we want to continue to limit the spread of it to save lives for the long haul. The models show there's not a lot of difference about when a stay-at-home order ends, whether it ends this week or next week or in 2 weeks. It was needed at the time to stop the exponential curve, which it succeeded in doing. But what's more important than the exact date it ends, by far, is the behavior that is sustainable for Coloradans in May, in June, and July. The way we act, the way we go about our lives, the way we earn our livelihood, the way we support ourselves, the way we have psychological fulfillment in a way that achieves the social distancing necessary to prevent a far worse outbreak that would overwhelm our hospital system and cost lives.
This will be the final question that we have time for. Blair Miller, you're on the line.
Hey, Governor, it's Blair Miller from Denver 7. Earlier today, Denver, the mayor and the Department of Health executive director said that they were working on a order to mandate that people will wear masks if they're outside, basically anywhere, not just at businesses. So I was wondering if that's something you would or could consider. And then also, has any other counties besides Eagle and Mesa applied for the variants?
So not that I know of. In terms of the second question, it doesn't mean that they didn't today, and I just haven't been informed. That's certainly possible. But those two have, and those two are, one has been granted, the other will be granted soon if it hasn't already. I simply don't have the answer for you, but we can get it for you from Jill Ryan, whether as a factual matter any have applied yet. I support mask wearing. It's important across our state. I walk my dog once a day with my kids, and we wear masks, Marlon and I and the kids. Very important. Whenever we go to the grocery store, wear masks. I'm very supportive of Wheat Ridge, which has already instituted a public mask wearing requirement, of any jurisdiction that's doing that. Absolutely critical to be able to increase the amount of the general public that wears masks. When I first announced kind of the mask concept a few weeks ago, and Coloradans, like Americans, are slow to warm to it, they're getting better. I said we're going to a mask wearing culture. This disease has a better trajectory of saving lives in areas that have mask wearing, whether that's Japan, whether that's China. Mask wearing is a norm there. And as a result, the R naught of the disease, the way the disease expands, is less. Wearing masks is a very simple act that we all need to do. And I'm very supportive of Wheat Ridge, of if Denver moves that way in public places. That doesn't mean when you're doing yard work in your own yard, you need to wear a mask. But when you're out on a trail that others are on, when you're going to the grocery store or any store that begins to be open in early May, very important to protect both the employees there and yourself that you wear a mask. Remember, we do have an order that we put in a few days ago that the employees at those stores need to wear masks. That, of course, is for both their protection and yours as well. And I really hope that all of us make that choice for the foreseeable future, become a mask wearing culture here in Colorado. It'll make a big difference. It'll save lives. It'll also reduce the severity and duration of the economic disruption. I'm going to go ahead and take one more. If Brandon is back, he can do it, or if somebody else.
Brandon, your line is unmuted.
So he's having technical difficulties. We'll take one more from somebody else. It can be a follow-up as well. I mean, if you just ask, we'll just take one more.
Katie Weiss, you are on the line.
Thank you, Katie.
Yes, thank you, Governor, for your time. I appreciate it. I wanted to ask if you wouldn't mind elaborating just a little bit further about how other counties here in the metro area are starting to move towards extending that that stay-at-home order, and how you think that might shift any types of mending we might see in our hospitals. Do you think that might further flatten the curve, make any greater differences? How that will help the general population? Thank you.
Yeah. So the stay-at-home order work, the April work has flattened the curve, right? We are probably at a R naught of between 0.9 and 1, meaning for every person who gets it, it spreads to somewhere between 0.9 and 1 additional people. Which means it's not really fluctuating much, which means that if people are extending it a week or 2 weeks, they should not expect a significant reduction in the virus in Colorado. That's extremely unlikely to occur. We're really seeing an R naught very close to 1. That's what we have to maintain during the safer at home phase. So we have to find a sustainable way where it continues to operate in a way where we're protecting our most vulnerable, is not rapidly expanding on an exponential curve like it was before the stay-at-home orders. And whenever these stay-at-home orders roll off, in some places April 27th, in some places May 8th, in some places in between, what's most important, that all the studies verify is most important, is how are people behaving in May and June after the stay at home. When it's safer at home, but more people need to earn a livelihood, need to go out, and need to engage in a psychologically sustainable way of life that we can maintain for the medium haul, meaning for several months until there's a cure, a vaccine, or herd immunity. So that's really what we're watching. We look forward to watching and working with jurisdictions that want to go a little faster, they'll want to go a little bit slower, depending on the health situation on the ground. As long as there's good, thoughtful approach to do that with stakeholders in the community, the health community, the local business community, the elected community. We're very excited to work with communities on the best way to tailor the public health response and the economic response to the needs of their residents. Thank you all for joining us. Our next event, our next publicity will be on Monday. It'll be a little different. We'll be walking through a lot of content because it'll be some of the guidance in all of the different areas around what folks need to do to be able to stay safe in different kinds of businesses that will be operating. I also want to thank everybody who's contributed to helpcoloradonow.org, the COVID relief fund. We had a call with many of the philanthropic partners the other day. They've already gotten more than $4 million out the door to help those most affected, raised over $12 million. You can make a donation at helpcoloradonow.org or sign up to volunteer. Thank you all for joining us. We will do these periodically as a way to not to replace the in-person ones, but to allow us to do this in a way that's safer for all of us, while still knowing that there's still some added value to getting physically together from time to time, as long as we're taking the precautions like wearing masks and being 6 feet apart during this difficult period. Together, we're going to get through this, Colorado. Thank you.